Hello everyone. Today we will be discussing our paper which is recently published in the Global Psychiatry Archives. The paper was accepted recently. It is entitled Association of Smartphone Use, Risky Behavior, Psychological Changes and Sleep Quality with Excessive Smartphone Use among Medical Undergraduates and a cross-sectional study. Smartphone use have been recognized similar to internet addiction, which is globally recognized now as a form of behavioral addiction. Excessive smartphone use has been associated with psychological symptoms, risky behavior undertaking, and poor sleep quality. In order to understand this association, we did a cross-sectional study across 224 medical undergraduate students in a tertiary care teaching hospital in North India. The recruited participants, after taking their informed consent, underwent a self-reported semi-structured questionnaire evaluation that covered their socio-demographic characteristic, the smartphone usage, the adoption of risky behaviors, and the psychological changes. Out of the 224 medical students that were surveyed, 88 students reported of smartphone addiction, which was a score more than 31 in males and more than 33 in females, as evaluated by the smartphone addiction scale of short version, already validated by Kwon et al. 186 students use smartphones in risky or inappropriate situations, and the most common risky behavior was usage of smartphones while walking, which was around 79.46% of students. When evaluated about the psychological change, we found that guilt was the most common across the entire gender. However, it was more common in females, around 39%, whereas males more reported that they felt anxious in poor network coverage areas. When evaluating this association further, we could understand that there was more amount of medical students who had increased in age. The mean age was around 21.2, had average duration of use of 4.7. So all of these findings were of p-value of less than 0.001, which showed a significant change. So as the students increased in their semester, the average use of smartphones also increased, along with an average increase in the smartphone addiction and a poor quality of sleep. We showed that as students had more addiction to smartphone, there was increased chance of being engaged in the form of risky or inappropriate situations. The risky situations that were understood were using while walking on the road, while crossing roads, and while driving. In inappropriate situations, using while ongoing of their class, right before sleep, right after waking up, among friends. Also, students reported a very high amount, close to 80% of usage across. Only in the sphere of driving, we could see that males were more engaged in risky situation, whereas across all other risky situations, it was females who were more engaged. The frequency of smartphone use was also more towards sometimes, which is a score of 3 or more than 3 out of 5 situations. Sometimes was 41% reported in the frequency range, whereas across 30% of students reported that they use smartphones often to very often. This is the psychological changes. We evaluated anxiety, annoyance when asked to restrict smartphone use, and the guilt associated with excessive smartphone use. When evaluating the psychological change that was observed, we could see that a high level of psychological change was associated with an increased average duration of use of smartphones, and therefore a poor quality sleep and a poor quality of general health overall. Thus, we could find that there was an increase in the risk-taking behavior in students who were average using of smartphone was high. They were using smartphones in risky situations despite knowing the harms, causing increased amount of distractibility. We also need to further understand what and how much is the level of the psychological change which is happening in students, and what are the vulnerability factors which make certain students more prone to development of smartphone addiction. There are also need for further longitudinal studies which could assess the impact of this risk-taking situations in medical students so that safety incidents and road safety accidents could be reported. We believe that digital well-being should be made a part of the curriculum in medical students, and they should be made aware of the inherent features of smartphone addiction. Thus, there is a need for doing well elucidated studies in future, especially taking medical undergraduates, because they are a cause of concern as they will be future physicians. And them being addicted and having behavioral addiction can lead to a long lasting effect in their future. Thank you. We hope that you give a read to the full version of the PDF of this file, which is already available on the Global Psychiatry Archives.